Hello, everyone. My name is Mena. I'm a Purchase Surgical Rage and Leighton Hospital crew in United Kingdom. I'm happy to talk to you today with discussing my paper, my article review about photoacoustic imaging in GI surgery as the first author. Um, as we see in this few pictures, X-ray on the left side, CT scan, MRI scan, and we have other methods of imaging and intervention in a way recently. Starting by the X-ray, I can just start to go historically and say since the intervention of X-ray in 1895, we can find radiology has invariably been the foremost dynamic technological field of medication, evolving from strictly diagnostic to high technological interventional tool, widely used nowadays in different medical specialties. But nowadays, surgeons and radiologists are powerfully concerned in these modalities and imaging technology and keeping overweighing between the pros and cons of each. And so I'm going to talk today about these recent updates in interventional technology and imaging, and mainly in GIT surgery with the pros and cons, if possible. So we have different modalities of imaging in GIT surgery. It's mainly divided in three main categories: non-invasive, minimally invasive, and invasive. Non-invasive like CT scan, MRI scan, ultrasound scan. We have ultrasound scan plus photoacoustic imaging, the one in orange we can see in that box, which we gonna discuss today. Minimal invasive in the endoscopy and all techniques and imaging that is using with the endoscopy use like white light source, white light endoscopy, and all this up to the EUS and EUS plus photoacoustic imaging as well. Invasive like the fluorescence and our fluorescence and IOS, which is used intraoperative. We're gonna talk about that later on. Again, in brief, this endoscopic imaging techniques, starting by white light endoscopy till down to photoacoustic imaging. White light endoscopy and photoacoustic imaging from 1 to 6. In brief, the main difference is the penetration depth and the wavelength used in these techniques. The white light endoscopy is mainly confined to the lining epithelium and the mucosa, but it cannot detect any further changes beyond the mucosa. Plus, it only can detect any changes in the color from pink to salmon pink to white color, but it cannot detect any earlier changes happening in the lining mucosa, which make it more limited endoscopic imaging modalities we can use nowadays compared to the photoacoustic imaging, which we gonna talk about it with the wider advantages and less disadvantages as we will mention later on. Photoacoustic imaging. Photoacoustic imaging is a new imaging technique that takes advantage of optically induced ultrasound signals in tissue. As we can see here, for example, in organs, malignancy, or tumors in these pictures, imaging is based on light absorption of the neoplasm or the tumor, as well as the low sound distortion happening, and that all conveyed to one of the ultrasound scans monitoring or screen. And cancer cells slowly develop a microvascular network, the angiodysplasia, which appears as a sign that tumor is growing aggressively, which can give different colors. As we see in these color change, it depends on the amount of blood, number one, amount of hemoglobin and type of hemoglobin in this blood, and number three, the amount of angiogenesis in these tumors, and can say this tumor is growing aggressively and exposed to metastasis. Again, as we see in this diagram, photoacoustic image is a combination between optical imaging and ultrasound imaging to quantify the properties of ultrasound scan with advantage of ultrasound imaging, deep field visualization, free X-ray free imaging, and the way sound sensors are properly coupled to the wavelength from the optical imaging corresponding to the target. And again, simply, this is the mechanism how it works. We have two modalities: the optical or laser excitation and the ultrasound detector or image construction. So we send the device and laser excitation to the tissue. We need to get image about, and this laser excitation can cause localized thermal expansion in the tumor or the cells, and the thermal expansion cause what's called acoustic wave, and acoustic wave conversion transmitted to ultrasound detector just focused on the tissue. And this ultrasound detection can be converted to the image construction, making the picture we have seen earlier, this one, these different colors, can show this acoustic wave translated to ultrasound pictures. Uses of photo-acoustic imaging nowadays, I think it's widely used in many specialties or different specialties. Start by any changes in blood vessels. It can detect earlier changes in atherosclerotic plaques and can call to what's called atherosclerotic plaque mapping. We can use in brain imaging, cancer detection, and other dermatological and breast issues. But we're going to talk today about mainly the applications of photoacoustic imaging in GIT surgery. So about the mistake. Starting by esophageal cancer. Nowadays, we can even detect the esophageal cancer earlier, starting by Barrett's esophagus. As we know, Barrett's esophagus is a significant risk factor for esophageal adenocarcinoma, and early detection of Barrett's esophagus enhanced the treatment results earlier. Previously, we were using the endoscopy and just take various random samples, biopsies from the tissues, and sometimes we are not sure which is the healthy tissue and which is the dysplastic one, and can miss some important areas with already dysplasia, and can wrongly take biopsies from healthy tissue which come back negative, but patient actually still have the Barrett's esophagus, and we're gonna miss it easily. But nowadays we can use the photoacoustic imaging, detecting all these changes earlier, and even it's not limited to the mucosa, it can be extended beyond the mucosa, detecting any change earlier in submucosal submucosal invasion. Any microscopic changes will result in high resolution imaging of the microvascular system and help the gastroenterologist or surgeons closely to close the gaps, allowing them to differentiate or distinguish between dysplastic and non-dysplastic areas. We can use it as well in the high inflammatory bowel disease, or an IBD, mainly can detect any oxygenated and deoxygenated hemoglobin in tissues by using the hemoglobin as a contrast, natural contrast, which can be reflected on the screen, showing any change in systemic and vascular changes related to the IBD with non-invasive manner. And we can use it as well in pancreatic cancer. As we know, we can use that as an imaging facilitates penetration to clinically significant depth, providing a good imaging technique that can be used intraoperatively. And using the high penetration depth of photoacoustic imaging can use intraoperatively to the surgeon and provide important information about the pancreas, any changes in the pancreas, which can be changing the result, the decision for the surgeon intraoperatively. Improve the advantages of photoacoustic imaging is it's a suitable screening technique because it uses non-ionizing radiation to image tissues in the real time, avoiding any harmful ionizing radiation, and at the same time still using the hemoglobin and melanin as natural contrast. We still can use any external contrast if we like to do so in different specialties, but mainly we can use it in GI surgery, depending mainly on the hemoglobin as natural contrast. We can monitor the angiogenesis. We get high resolution images compatible to the ultrasound scan, high penetration depth. But as disadvantage, we still talk about image quality. Although we say it's compared to ultrasound scan, is still good resolution, but generally the image quality is still affected because we say this combination between the ultrasound scan and optical, and the wavelength we actually use for photoacoustic is still low frequency ultrasound probes. The main idea for this to detect deep penetration and deep tissues, but detecting deep tissues with the low frequency ultrasound probes still results in limited high output and limited view curvature and image formation being formed that perform acoustic diffusion, which is still affecting the image quality in a way. And number two, and this is the second part of photoacoustic, the laser we are using the photoacoustic imaging, and we have to think about the laser safety and energy requirements is not available widely nowadays, and the ability to maximize the laser intensity for some tissues outside the current skin still limits make it possible to improve the poor image quality. And I think laser safety and energy requirements still one of the challenge and limitation about photoacoustic image, which you can expect it to be changing repeatedly in the future. Conclusion, I think generally photoacoustic imaging is a modern method of gastroenterology, usually imaging usually used in conjunction with the ultrasound scan or sometimes with the fluorescence imaging, and diagnosis of angiogenesis, oxidation of the blood in esophagus lining the colon, may be achieved by using the photoacoustic imaging, although we still have challenges and limitation for using the photoacoustic images, but in the specialties and in the fields I have just talked about it briefly because of the time limit in a way. But I think still doing its job in a way, and to detect any mucosal, submucosal changes earlier than any other modalities, to detect any cancer changes on any other changes regarding the specialty organ used in it. So ability to image all the mucosal and submucosal layers is significant advantage of these PA techniques over the widely employed optical imaging techniques. Thank you everyone for your time. If you have any question, you can come back to the normal publication paper, and you can contact me anytime. Thank you.